Well, joining me now is the Institute for Public Policy Research's Chris Thomas, who headed up the think tank's Commission on Health and Prosperity. Chris, thank you for joining me. First of all, let's just talk about those numbers. They are extraordinary and massive. How many of those 2.5 million do you think really can be put down to COVID for one reason or another?
Yeah, certainly a good proportion. You've already talked through how many people we've seen rise in terms of that figure since COVID-19 began. In that figure will likely be some people with long COVID and symptoms thereof. In other cases, it will be people that are still struggling to get the healthcare that they need because of disruptions to things like the NHS and to adult social care. So that compels to have accelerated the problem. But I think what we have to remember is that this is, whilst much worse than it was since COVID-19 began, not a trend that begins in 2020. We've seen, kind of population health and challenges with healthcare happen across, the 10 years leading up to the COVID-19 pandemic. And so I think that should inform our solutions. It's both about undoing some of the damage that was done by the pandemic, but it's also thinking about some of those deeper structural problems that we've been contending with for much longer.